Many people know the name Florence Nightingale as a female pioneer of nursing and as someone who led a team of nurses to the Crimea. However, she was also a mathematician and statistician and did much more than nurse the sick. After she returned from the Crimea, one of her interests and concerns was the high mortality rate of soldiers when stationed in barracks around the UK when the army was at rest, so no war going on, as their mortality rate was far higher than the males of the same age in the general population. If she were around today, I am sure that she would be similarly interested in the increased mortality rate of certain demographic groups in the population due to COVID-19. Nightingale investigated this disparity by looking at the available data. One of the problems was that the data was collected differently in different places. So army recruitment centres had different criteria for recruiting and rejecting soldiers. So the entry level was not consistent. And we've seen during the pandemic that different countries record and report data in different ways, which has made comparisons difficult in some cases. There were very poor hospital records kept, so one didn't have the full picture as to how many soldiers had been admitted and then died in hospital. When they did start counting admissions, they then counted the same soldiers numerous times as new admissions were mixed up with those who were already there. When Nightingale looked at the data related to cause of death, she found that there were serious inconsistencies and discrepancies between the same data from different sources. Also, soldiers' ailments were recorded based on their symptoms. So, a soldier who had pains in their back and legs might be recorded as having died from chronic rheumatism rather than scurvy. Reporting the cause of death in the current pandemic is not as straightforward as one might think. For example, there have been some discussion about whether one only reports COVID as the cause of death where there's been laboratory diagnosis, or whether one includes clinical assessments. The number of tests being carried out at a particular time in the pandemic also plays a major part in this. Back in Victorian times, data were more often used for show and propaganda rather than for meaningful decision making. Data on soldiers' deaths were grouped together over large periods of time, so that when taking averages, this just made no sense at all. Nightingale commented, "An engineer doesn't calculate the average velocity of the whole river, but takes it in sections." And she showed how you could break the data down in order to make meaningful comparisons. In some cases, the army was invaliding sick soldiers before they died in order to reduce the high mortality rate. This led to her concluding that if this continued and escalated, the army would appear immortal, so as no man would die in it. Later, elsewhere, she found officials were leaving out specific causes of death from the mortality figures. She found this quite amusing and commented that it was very convenient indeed to leave out all deaths that ought not to have happened. And it is certainly a new way of preventing preventable mortality to admit it altogether from any statement of mortality. Then they would exclude deaths above 60. Their principle, if logically carried out, is simply to throw out all ages and all diseases, and then there would be no mortality whatever. She didn't only comment on the data, but she also graphed it intelligently so that it told a clear and accurate story. She created various graphs and charts, including just simple line graphs that clearly showed the problem that more soldiers were dying in certain age brackets than civilian men. She tried to put a cost on this and depicted in another graph, actually forecasting the army's effectiveness if their mortality rate, rate of mortality and invaliding was as good as the current rates in the general male population. The result of her work analysing this data showed the problems stemmed from the insanitary conditions in barracks and military hospitals. She was also a pioneer of healthcare for the poor and a champion of equal rights for women. Her guidelines on the collection of hospital statistics were ratified by the International Statistical Congress, and this, and her work comparing the mortality rates of the army at rest with the civic male population, paved the way for new guidelines concerning the construction of new barracks and hospitals. These, in turn, played a major role in improving the health of the armed forces and gaining Nightingale recognition as a statistician. Nightingale's analytical work helped government and the armed forces to make better decisions. As a result of her diagrams representing mortality data, government statistics were never the same again, and indeed her easy-to-visualize charts were taken up subsequently in the routine publication of the census and other data. If she were around today, I have no doubt that as well as developing her own models to forecast the spread of COVID-19, she would also be discussing inconsistencies in the data regarding the level of infection and deaths in the various populations and doing what she could to lobby government to make appropriate changes. I want to end with a quote of Nightingale's on statistics, which I think is particularly apt at the current time. The main end of statistics should not be to inform the government as to how many men have died, but to enable immediate steps to be taken to prevent the extension of disease and mortality.